Welcome to Amazing Mind, the HMI web TV talk show that introduces you to all sorts of interesting people and topics related to subconscious behavior. My name is Lisa Machenberg, hypnotherapist, HMI instructor, and host. Today we have an amazing guest who's going to talk to us about hypnotherapy and our clients who are struggling with trauma. Please help me welcome Dr. Anna Scully. Now, Dr. Scully is a PhD psychologist with a private practice in Westwood, and she specializes in dealing with clients who are suffering from trauma. Please help me welcome Dr. Scully. Thank you very much. Well, thank you so much for joining us today. And can you tell us what exactly is trauma?
Well, I think the best way to think about trauma is twofold. There's the definition of trauma in the moment, and then the definition of post-traumatic stress. In the moment, trauma is anything that is a serious threat to the person's life, their health, their well-being or sense of self, or else experiencing or witnessing someone else be in harm's way.
Well, you know, we talk about that here at the Hypnosis Motivation Institute, that a witness to violence is a victim of violence. Would you say that that's true too?
Absolutely. I think that, for instance, in domestic violence situations, the person who is being abused is obviously traumatized, but so are any of the children or witnesses in the home who are observing the abuse as well.
What happens physiologically in the body during the trauma in the moment?
Our bodies are geared through evolution to respond to danger situations. So if you're, minding your own business and a lion jumps out at you, the part of the brain, your limbic system, is going to go onto high alert. It judges danger and safety, and it's going to activate your sympathetic nervous system, which is the fight or flight response, to help you either run away from that danger or fight it off. And some of the things that happens with that, your heart rate goes really fast to get blood to the muscles. Your breathing becomes fast and shallow. You're going to have adrenaline coursing through your body. You're going to be very aware, hyper aware, where people say that when something happened, it's like time slowed down so that they could be aware, and we're aware of every little minute thing that happened. Sure. So that's great for helping you run away from that lion or fight it off. But the problem with post-traumatic stress is that it lasts a long time after the trauma itself is over. Once the danger is past, it's like the limbic system, that needle gets stuck in the red, gets stuck in the danger zone. And so the person experiences, again, activation of that fight or flight response frequently, feeling panic attacks or rapid heartbeat, feeling adrenaline rushing through them so that they're anxious or have feelings of rage.
Really?
Also having that sense of hypervigilance, where they're looking over their shoulders because everything feels dangerous.
You know, one of the things that I've seen seems kind of like the opposite. Certainly people in my practice who've returned from the military or have had a traumatic event, the loved ones say, well, the person is detached, the person is robotic, the person, it's not the same person who left, the person who returned. What's that?
That's another symptom of post-traumatic stress, which is kind of the opposite of that hyperarousal. It's that place of numbing out, where the person is overwhelmed with the emotions and deals with it by detaching from their own emotions, their own body sense, their loved ones, the things that have been important to them.
Yes.
And that's another very important thing that we see, is that in trauma, the person goes back and forth with post-traumatic stress between these two states, between the hyperarousal and the fight or flight and that numbing out.
So what's happening in the brain that's confusing? I'm in a dangerous situation that's life-threatening, and being in a safe situation, what's going on?
There's that sense again that the limbic system gets stuck on danger, and so there's not a sense of safety that happens. The other thing that happens so frequently with, and you see this with people coming back from combat, but also with other survivors of trauma, is that the stress and the trauma affects memory and the experience of memories in the past versus in the present. The limbic system, which is the part that gets lit up with trauma, is also in part responsible for encoding our memories and filing them kind of in context. So if you think about it as kind of a filing cabinet in your brain, and for most of us, our memories are filed away pretty neatly. I can remember riding my bike when I was 10, and that's filed as a long time ago, versus driving here, which is filed as something that's recent. But for people with trauma, during that trauma, the limbic system isn't filing things away. It's more like things just kind of get strewn on the floor of your brain.
Yeah.
And people who are experiencing PTSD or any kind of post-traumatic stress, oftentimes they'll get triggered by something, and it's like they trip over something that's on that memory on the floor and fall into it. So they're experiencing it as if it's happening right now, instead of in the past.
Well, what kind of things cause trauma? We talked about child abuse, or witnessing spousal abuse, or a sibling getting hit, even if you're not the one getting abused.
Absolutely, yeah.
We talked, of course, about the combat. What other things cause trauma?
There's a lot of things that can cause trauma. For instance, car accidents are a big thing that causes trauma. Being in any kind of a natural disaster, fire, hurricane, the things that are
happening in Japan. That's very, very topical.
Exactly. So there's probably a lot of people who may need some some work in terms of trauma after the fact. Also, other things that we don't necessarily think about, such as having a life-threatening illness, or a heart attack, or being diagnosed with cancer. Sometimes going through surgery can be very traumatic. Childbirth can be very traumatic.
Absolutely.
Also, for kids and adolescents, sometimes severe bullying can be a huge trauma.
You know, it's funny that you mentioned that. I tripped over a file of memory that I had left on the floor. I was on Facebook, just going through Facebook, seeing the friends of my friends of my friends, and I came across the girl who tormented me for 4 years in high school. I won't mention any names. And I saw her picture, and I clicked on it. You know, it was like a car accident, you want to look away, but you can't. And I actually felt that rapid heartbeat, and I fell into the file, I fell into the hole where, instead of thinking, even I'm 52, this happened the last time she bullied me, I was 18. And instead of thinking, well, what's wrong with her, I went back to that very scary place. She bullied me, what's wrong with me?
Right.
So bullying can be traumatic, and what just happened to me?
You said it just right. You fell back into that place, and so you're thinking in that moment, and your emotions in that moment weren't that of an adult who is rational and able to kind of think this through. Instead, it's of that teenager. It's of that kid who, and the reaction is of that kid. It's, for instance, someone who was abused as a child, sexually abused as a child. Their partner or loved one will touch them in a particular way, and boom, all of a sudden, it's like they're back in that moment of abuse. Their physiology, their emotions, their thoughts are back in that moment, and they're responding to the abuser, not to the loved one. So you're responding to that bully as you would as a child, not as an adult.
Absolutely. One of the reasons I wanted to have you on the show, Anna, is you're so good and so gentle with helping people who are experiencing trauma or post-traumatic, not in the moment, but the artifacts of it. When someone calls you and is coming in, tell me a little bit about your treatment plan. What are your goals?
Sure. Well, I think one of the biggest goals is to provide different pathways for working with that trauma than the person is usually using. So the idea that, people say, if you do what you've always done, you're going to get what you always got.
That is very, very true. Don't do the same thing and expect a different result.
Exactly. So with victims or survivors of trauma, a lot of the times there's a lot of lack of control. There's a lack of kind of self-efficacy that comes in part from the trauma, because one of the things that happens that seems to increase the chance of post-traumatic stress is that our fight or flight response just didn't work.
No, we still had the combat. We still weren't safe. We still got teased in the locker room in junior high. Oops, that was me.
Right, you couldn't run away from it and you couldn't fight it off. And so that causes that place of helplessness. And then also the effects of the post-traumatic stress, the symptoms can feel exceptionally out of control for the person.
Yes.
They're having flashbacks or recurrent nightmares or numbing out or all of these panic attacks or things that they can't control. And that can also create more stress and more helplessness.
Yes.
So giving resources, first of all, educating people about the effects of stress on the brain, on their physiology, normalizing the symptoms that survivors of trauma feel, so they don't feel crazy and alone in this.
Crazy and alone. And I love what you said, is just coming into the office and talking about it. Can you actually see people getting hyperarousal or numbing out when they're talking?
I think if you just come in and someone says, okay, tell me about your trauma, you're going to go through it in the same way that you're used to going through it. So either you're going to re-experience it and go to that kind of hyper-aroused fight or flight state, or you're going to numb out and describe it as if you were, reading a story from a magazine.
So you can actually see it.
Right.
When we come back, I would like you to go through your method, your 4-part method of helping clients who are experiencing post-traumatic stress to build those brand new pathways in the brain, so you don't do what you did to get what you got.
Right.
I love it. So we're going to take a short break, but please stay tuned, because when we come back, we're going to talk more to Dr. Anna Scully about how we can help our clients who come in with post-traumatic stress. Stay tuned. With trauma. Please help me welcome Dr. Anna Scully. Now, Dr. Scully is a PhD psychologist with a private practice in Westwood, and she specializes in dealing with clients who are suffering from trauma. Please help me welcome Dr. Scully.
In the moment, trauma is anything that is a serious threat to the person's life, their health, their well-being or sense of self, or else experiencing or witnessing someone else be in harm's way.
Well, we talk about that here at the Hypnosis, the HMI web TV talk show that introduces you to all sorts of interesting people and topics related to subconscious behavior. My name is Lisa Machenberg, hypnotherapist, HMI instructor, and host. Today we have an amazing guest who's going to talk to us about hypnotherapy and our clients who are struggling. Well, thank you so much for joining us today. And can you tell us, what exactly is trauma?
Well, I think the best way to think about trauma is twofold. There's the definition of trauma in the moment, and then the definition of post-traumatic stress.
Welcome to Amazing Mind.